Let's see the prevention, diagnosis and treatment of diabetes. With the help of 4 types of tests we can easily diagnose the diabetes, its type and stages. These 4 types of tests are fasting plasma glucose test, random plasma glucose test, a WIC test, oral glucose tolerance test. Diabetes is diagnosed with 4 types of test methods. These are random plasma glucose test, fasting plasma glucose test, a WIC test, oral glucose tolerance test. In fasting glucose test, patient needs to omit eating and fast for about 8 hours in night. After that, this test is done in the morning time. Patient can take sip of water only. Plasma glucose range 126 ml or above shows the presence of diabetes. Random plasma glucose test can be done anytime, without the need to fast. OMIC test, also called a OMIC, or glycated hemoglobin test. In this test we will notice average blood glucose level of patient for the past 2-3 months. Measures the amount of glucose attached to the hemoglobin and protein level in red blood cells that can carry oxygen. In this test no fasting requires. In oral glucose tolerance test, blood glucose level is first measured after an overnight fast. Then patient needs to drink sugary drink. Blood glucose level of patients is then checked at hours 1, 2 and 3. This slide explaining the ranges of different diagnostic tests in normal individual, prediabetes and diabetic stage. The range of fasting glucose is less than 100 in normal individual. For prediabetes it is 100-125 mg, and for diabetic state it is 126 or greater than 126 mg. For random glucose test it is less than 140 mg in normal individual. For prediabetes it is 140-199 mg, and for diabetic state it is 200 or greater than mg. In OMIC test it is less than 5.7 in normal individual. For prediabetes it is 5.66.4. And for diabetic state it is 6.5 or greater in percentage. mg. For oral glucose tolerance tested is less than 140 ml in normal individual. For prediabetes it is 140-199 ml, and for diabetic state it is 200 or greater than mg, which are the same values as of random glucose test. To management of diabetes, patient should keep his blood glucose levels near to normal by following a good diet plan, taking prescribed medication and increase his activity level. Patient should maintain his blood cholesterol and low levels and triglyceride levels near the normal ranges as possible. Patient should control his blood pressure. Blood pressure should not be over 140 mmHg. Patient should follow healthy meal plan. Use a Mediterranean diet: vegetables, whole grains, beans, fruits, healthy fats. Patients try to exercise at least 30 minutes most days of the week. Walk, swim or find some activity of enjoy. Patient should maintain a healthy body weight. You should work with your healthcare team to develop an appropriate weight loss plan. Patient should take his medications and insulins as according to the advice of his physician and do not avoid his doctor's appointments. Should visit the healthcare provider on time. He should avoid smoking, fat and sugary content. Let's see the treatment options for diabetes superficially. You will get the details of treatments in the upcoming presentations of diabetes and its types. Treatment options for diabetes are insulins, transplantations and oral medications. Insulins are divided into 4. The basis on onset of action produce. These are rapid-acting insulins, long-acting insulins, short-acting insulins, intermediate-acting insulins. Organ transplantation is also one of the treatment options for diabetes. Examples are pancreas transplant, pancreatic islet transplant, immunotherapy. Oral medications is the widely used treatment for diabetic management and control. Different classifications of drug classes given in different combinations as per the condition of patient and type of diabetes. Some of the commonly used medications are sulfonylureas, biginides, imiglitinides, alpha-glucosidase inhibitors, thiazolidinesians, TYK4 inhibitors, SU2 inhibitors, others. One of the study conducted on diabetic patients defines that only 28 of patients adopts healthy lifestyle, while 33 consume more junk foods, 14 only taking plenty of water, while only 25 observed blood glucose as a preventive measures. Among the US population, where 2018 estimates about 34.2 million people of all ages or 10.5 of the US population suffering from diabetes. One of the study conducted in US in 2013-2015 shows the diabetic male and female patients with different race ethnicity, in which American Indian and Alaska Native in both male and females have higher proportion of diabetic patients. In another study conducted in America have only 4 of patients between the age group of 18-44, 17 of patients between the age group of 45-64, while 27, most higher proportion of diabetic patients seen in age group of 65 years and older. To stay connected for more healthy updates, do like and subscribe our YouTube channel.